How does a nation in the grip of an emergency shutdown find a way out?
What we need to do is keep the restrictions in place and then slowly lift them.
To get people back on the streets, the Prime Minister says we need to do three things. The first is more testing. So far, we've just been testing people with symptoms of COVID-19 or other high-risk groups like returned travellers. But now we need to try to test everybody. It's called sentinel testing, testing different people in different ways.
We might also test a sample of the community on a regular basis just to check whether the coronavirus has spread into the community and people are infected but they don't have any symptoms.
One very different way is to examine what's going down the toilet.
To spot an early outbreak that might occur that we might miss through other forms of testing. Also, the degree of viral load we might find in the faeces could give an idea of how severe the outbreak is.
The second part of the exit strategy is contact tracing. Once a person tests positive for COVID-19, massive nationwide teams track down everybody that person has interacted with. Small teams used to track cases of measles or HIV have been dramatically expanded. The government's also developing an app that will help authorities find anyone who's been in contact with confirmed cases. Today, refusing to rule out forcing everyone to share their location data.
I've always been a believer in the Australian people making the right decision, and so I think a voluntary approach at first is definitely the way to go.
Even with all those measures in place, outbreaks are still possible, and then the response becomes important. Australia is now in a much better position to contain an outbreak than it was when COVID-19 first arrived. We could see further use of the Defence Force, which was called in to help address an outbreak in Tasmania this week. Whatever the case, experts say patience will be required.
What this is really about is finding a way to fine-tune the degree of lockdowns, not in terms of finding our way out of this COVID-19 situation, which is going to go on for a while.
Michael Slezak, ABC News.